Yes, my name is Lyn Newkirk and I live in Weymouth, and I'm here to give testimony on an act establishing Medicare for all in Massachusetts, H 1267 and S 766. I'd like to thank you for this opportunity. I'm a retired CPA with over 30 years experience in public accounting, and because of my background, I was really interested to see how the numbers worked with small businesses and their employees under the single payer bill versus what they are currently paying. So what I did, I set up a hypothetical company with $3 million in revenue, 10 employees making $80,000 each. I found that the savings were significant, and I have included these calculations in my written testimony. But using relatively conservative figures, I found that the company and its employees could save $94,500 a year. And this, as I said, was a very conservative calculation and would be much higher for many companies. So it was clear to me small businesses and their employees would see a significant benefit under single payer. And while I was putting this together, I reached out to an old construction client of mine to see if the figures of using $2,000 for family and $800 single was reasonable, and we had an interesting exchange. He said these figures were close to what they were paying, but their insurance was terrible. He said the good insurance was between $2,500 and $3,000 a month for family. He says, but we can't afford that. He then said, hopefully you can do something with it. It's killing us. So I think it's pretty clear that if businesses really understood how much they could save in money and time under single payer, I believe you would have overwhelming support from them. And then the other area I was looking at was just what was happening with our local towns and municipalities and what they were paying for health insurance and how it was affecting them. In my town of Weymouth, the increase in employee health insurance was 6.4% in 2021 and represents 13.2% of the total budget. In the executive summary for the budget, it said, to offset these rising fixed costs, the health insurance, and get a more fiscally responsible budget, we had to reduce other department budgets and line items by more than $1.7 million. That's $1.7 million that's taken from our schools, our roads, our water departments, and other services. And you could see similar increases and comments in other towns along the South Shore, Scituate and Quincy and Braintree. So basically, in summary, how I've been looking at this, small businesses, employees would realize there's significant savings under single payer. Town services currently are suffering because of these rising insurance costs that are out of control. And there's numerous studies that showing that Medicare for all or single payer will save money. So put that together with universal coverage and improved healthcare outcome, it makes me wonder why we wouldn't have single payer. And I urge you to support these two bills. Thank you.
Thank you, Lyn, and offering that perspective from a business standpoint. I appreciate it. It's helpful.